Les Roberts joins us now from Syracuse, New York. He's one of the main researchers in the study. He was with Johns Hopkins when he co-authored the study, but has just taken a post at Columbia University. Les Roberts, welcome to Democracy Now!
Hi, Amy. It's nice to be with you again.
It's good to have you with us. Why don't you lay out exactly what you found?
Sure. We, as you said, went to about 50 neighborhoods spread around Iraq that were picked at random, and each time we went, we knocked on 40 doors and asked people who lived here on the 1st of January, 2002, and who lived here today, and we asked, had anyone been born or died in between? And on those occasions, when people said someone died, we said, well, how did they die? And we sort of wrote down the details, when, how old they were, what was the cause of death. And when it was violence, we asked, well, who did the killing? How exactly did it happen? What kind of weapon was used? And at the end of the interview, when no one knew this was coming, we asked most of the time for a death certificate. And 92% of the time, people walked back into their houses and could produce a death certificate. So we're quite sure people didn't make this up. And our conclusion was, comparing the death rate for that 14 months before the invasion with the 40 months after, that the death rate is now about 4 times higher. And in fact, it's twice as high as when we last spoke 2 years ago and when we did our first study. So things have gotten bad. As you stated, we think about 650,000 extra people have died because of this invasion, and about 600,000 of them, so 90%, are from violence.
Well, I'm sure you've heard by now the responses of President Bush and military leaders about this. What is your response to their saying that this is not credible?
I don't want to sort of stoop to that level and start saying general slurs, but I just want to say that what we did, this cluster survey approach, is the standard way of measuring mortality in very poor countries where the government isn't very functional or in times of war. And when UNICEF goes out and measures mortality in any developing country, this is what they do. When the U.S. government went at the end of the war in Kosovo, or went at the end of the war in Afghanistan, and the U.S. government measured the death rate, this is how they did it. And most ironically, the U.S. government has been spending millions of dollars per year through something called the SMART initiative to train NGOs and UN workers to do cluster surveys to measure mortality in times of wars and disasters. So I think we used a very standard method. I think our results are couched appropriately in the relative imprecision of this. It could conceivably be as few as 400,000 deaths. So we're upfront about that. We don't know the exact number. We just know the range, and we're very, very confident about both the method and the results.
Les Roberts, this was President Bush when he was asked about the study Tuesday during his morning news conference. He dismissed the study, as you know, and said Iraqis are willing to tolerate the level of violence in Iraq. The question came from CNN's Suzanne Malveaux.
A group of American and Iraqi health officials today released a report saying that 655,000 Iraqis have died since the Iraq War. That figure is 20 times the figure that you cited in December at 30,000. Do you care to amend or update your figure, and do you consider this a credible report?
No, I don't consider it a credible report. Neither does General Casey, and neither do Iraqi officials. I do know that a lot of innocent people have died, and that troubles me, and it grieves me. And I applaud the Iraqis for their courage in the face of violence. I am, amazed that this is a society which so wants to be free that they're willing to, that there's a level of violence that they tolerate. And it's now time for the Iraqi government to work hard to bring security in neighborhoods so people can feel at peace. No question it's violent, but this report is one. They put it out before. It was pretty well, the methodology is pretty well discredited. But I talked to people like General Casey, and of course the Iraqi government put out a statement talking about the report. Yeah.
30,000, Mr. President? Do you stand by your figure, 30,000?
I stand by the figure. A lot of innocent people have lost their life. 600,000 or whatever they guessed at is just, it's not credible. Thank you.
And again, this was General George Casey, the top U.S. military leader in Iraq, who was also asked about the Lancet study.
I have not seen the study. That 650,000 number seems way, way beyond any number that I have seen. I've not seen a number higher than 50,000. And so I don't give that much credibility at all.
What's the 50,000 number? Where did you see that from?
I don't remember, but I've seen it over time.
Is it a U.S. military estimate?
I don't remember where I saw that. It's either from the Iraqi government or from us, but I don't remember it precisely.
General George Casey and President Bush. Les Roberts, your response, and also to President Bush saying Iraqis tolerate this level of violence.
Well, we didn't do a poll of Iraqis about their tolerance for the level of violence, but I think that that Iraqis are pretty unhappy with the level of violence. And I think there are a couple of issues that arise because of this. First of all, I'm not so surprised that entities that monitor newspaper reports or groups that are looking at official government statistics think that it's 10 times lower than the real number. We have gone and looked at every recent war we can find, and only in Bosnia did all governmental statistics add up to even 1/5 of the true death toll. And in Bosnia, the rate was 30 to 40%, with huge support for surveillance activities from the UN. So it's normal in times of war that communication systems break down, systems for registering events break down. And in Saddam's last year of his reign, only about 1/3 of all deaths were captured at morgues and hospitals through the official government surveillance network. So when things were good, if only 1/3 of deaths were captured, what do you think it's like now? Pardon me. And another thought is that, quite unrelated, if someone said in the 9/11 attacks, I think only 200 or 300 people really died, we would be really, really upset. And I think in the long view, the danger of discarding this study, if it's correct, is that at a moment when we as a society should be showing contrition, our leaders have essentially expressed indifference to an extraordinary level of suffering, and that's just the wrong message in terms of either our long-term security or peace in the Middle East.